Welcome back to another exciting episode of Have You Seen Sandy? And I'm your host, Sandy Thompson, Promotional Assistant for the City of Pittsburgh. You know, more and more people are moving into our city, and so part of moving is being concerned about our health care. Are we going to have the same kind of health care that we've had in our previous location? And especially if we're coming from a larger town to a smaller town. So I thought it would be really fun for us to go out and visit our local hospital, UT Health Pittsburgh, and let's see what we can find out together.
Hi Sandy, thank you for coming and visiting our hospital and seeing what we offer and the services we provide this community.
Yeah, well, so nice to meet you, Guy, and thank you for having me, and thank you for participating in an episode of Have You Seen Sandy?
Okay. What can we answer? What information we can help?
Well, first of all, why don't you tell me a little bit about what are some of the specialties and that you have here that you offer at the hospital?
Awesome. Okay, we can start with the ER. We have an ER. The ER opens 24/7. And one of the things that we do mind in the ER is how we get patient in and get treated and taking care of them without having a long wait time. And so we strive to be below 12 minutes in terms of from coming in, seeing a doctor and having a conversation with someone before you discharge. Now, also we do provide a rural health clinic. The rural health clinic is where we have patients and consumers coming and seeing our primary physicians and as well as specialists that are in the hospital.
Okay.
Inside the hospital, we are licensed for a 24-bed, what we call med-surg, and as well as 4-bed IMC. And part of the 25-bed, we do have the capability to transition it to a swing bed. And what that is, it gives people an opportunity, those who may need antibiotic, wound care, an extended stay. Instead of the short-term acute care stay, they are able to stay and have the services that we do provide in that facility. So we do have private room. We offer Wi-Fi, free parking, and as well as being able to have community education that we offer. And when you look at the rooms that we have, not only they are private, they do offer a patio that oversees a lake. And so that's a good opportunity for
room with a view.
Yes, for family members to enjoy themselves and be able to come. And then we have visitation that's not restricted, and it's a way of allowing family members who are working and may not be able to come during the day to come and visit their family members as well.
Well, I know that sometimes being in the hospital, it can be a scary moment, a lonely time as well. So having a family be able to come in and out and hang around is an important feature.
Definitely a great opportunity and it's part of the healing process, right? And so that's why if your family's around and you're able to interact with your family, it helps with that healing process.
So what if I'm needing some, after my stay at the hospital or my surgery and all, do you have some aftercare options that would be helpful to me?
We do have an opportunity. There's a new initiative that we have, Care Harmony, which is a healthcare partner that we have. They are able to follow the patients after their stay in the hospital or after their visit as a way to kind of address the social determinants of life of them. And then also too, if you came from the hospital and then you need extra care, we do have a fitness center where those who are in need of more rehab, outpatient rehab can go to that. And as well as the clinic, the rural health clinic, where you can follow up with your PCP or your other primary physicians that you may have.
Okay, well thank you so much, that was very informative.
All right, are you ready to take a tour of the hospital?
I would love to take a tour.
Let's go.
Let's go. Well, Casey, this is a lovely room, very impressive. So what I wanted to ask you is, I know that when I first moved to Pittsburgh, I was really concerned about the reputation of the hospital, and I kind of asked around, you know, what the reputation and the accreditation was. So can you share a little bit about that with me?
Yeah, let's talk about reputation first. Care is very personal. A lot of my staff live in the area, and so we are constantly caring for our own families. So we have a great reputation, both quality and patient satisfaction wise. We're a top-rated hospital, top-rated rural hospital by Leapfrog. We're accredited by the Joint Commission, which you see that on large hospitals and small, so we're proud of that gold seal of approval. We're a level 4 trauma designated facility and acute stroke ready, recently resurveyed there. Our lab is CLIA certified, so So all those certifications that you see in big hospitals, you get them all right here in Pittsburgh.
Okay, well, that is impressive.
I'm super proud of it.
That puts my mind at ease for sure.
Yes, yeah, and the room is gorgeous. Super proud of.
This is a gorgeous room.
Yeah, super proud of the facilities that we have.
So can you talk to me a little bit about, in today's times, we're all very nervous about infectious control and disease and cleanliness. Can you kind of talk to me a little bit about what kind of measures that UT Health takes to keep the hospital clean?
Absolutely. We have a full staff of environmental service workers that work around the clock 24/7 to keep us as safe as we can. We put the infection prevention in their hands because that's what they are. They're not just housekeepers. We also have a full-time infection prevention nurse who does a whole lot of what we call quality tracers. So she inspects areas day in and day out, looking for process improvement. We're a high reliability organization, which means we encourage our staff to report things that just aren't quite where they need to be so we can fix them.
Yeah.
So we take it all very, very, very to heart, and we want the best patient safety and employee safety.
Well, I appreciate that. Thank you. That does put my mind at ease about whether I'll go out sicker or that I came in. So.
That's right. Our goal is to heal you, not harm you.
Thank you. Thank you.
How was the tour?
It was fantastic. I loved meeting everybody and then seeing this beautiful facility.
It's awesome to be able to have you coming here and seeing what we offer and sharing with the community and anyone who needs it.
Well, before I go, would you like to add a few more things about, tell us about your website or any last comments before we go?
Sandy, we do community outreach. We also have a community educational program that we put together where we educate people about diabetes and other things relating to health, and it's done mostly by our physicians and our other providers. Also, we have our volunteer program. It's a way for people in the community who are interested in volunteering, and even students, if they for community hours, they are able to come here and volunteer and help serve the community. And then if you are interested in knowing more about our facility and what we do, go to www.uthealthpittsburgh.com, or you can call 903-946-5000. Thank you for being here, Sandy.
Well, thank you again for
it.
having me.
Awesome.
Thank you again for joining me on another episode of Have You Seen Sandy? And I hope you enjoyed this tour, and I hope you enjoyed meeting some of the important people that work here at UT Health Hospital. For more information about UT Health Pittsburgh and other medical services in Pittsburgh, go to www.pittsburghtx.gov and look under the Visit Pittsburgh tab.